Okay, let's dive right into this explainer. Today, we're breaking down a massive, truly fascinating shift detailed in the Macro Butler's latest weekly newsletter, which is titled Code is the New Cure. We're going to explore how artificial intelligence isn't just some shiny new medical gadget, but is fundamentally acting as an economic rescue mechanism for modern medicine. It's a story that might wear a lab coat, but at its absolute core, it's about the largest cost center in the developed world finally learning how to behave efficiently. The doctor treats what has happened. The algorithm bets on what will. This brilliant quote from the newsletter really sets our baseline for today. Think about it. For all of modern history, medicine has basically been a reactive repair trade. You break down, and a highly trained but usually exhausted human arrives late to the crime scene, dusting for fingerprints long after the damage is done. Every physician has had to treat a disease after it starts screaming. But the algorithm? It's about to change the whole game by betting on what will happen, stepping in and finding the patient way before the patient ever needs to find the emergency room. We've got a lot of ground to cover, so here is our roadmap. We'll be unpacking this across 6 interconnected pillars. First, the medical bandwidth crisis. Second, unburying the doctor. Third, predicting the molecular whisper. Fourth, rewriting drug discovery. Fifth, overdiagnosis and systemic risks. And finally, the macroeconomic rescue. All right, kicking things off with Section 1, the medical bandwidth crisis, and how we are quite literally buried under the data. The 20th century model was, frankly, by habit, purely reactive. You know the drill. Symptoms pop up, you go to a doctor, and by that point, the disease has already been running the clock for months or years. You're basically waiting for emergencies to arrive by ambulance. The AI model completely flips this to being proactive. Utilizing flawless pattern recognition, it collapses that timeline. It catches the incredibly subtle, molecular whisper of a disease years before it ever becomes a physical emergency. It's a huge divergence. We are moving away from playing detective on a cold case, waiting until a disease hits stage 3 and presents a massive bill. Instead, we're transitioning to an AI-powered system that reads through towering stacks of health data with infinite patience, predicting and preventing the illness before it takes hold. And here's the economic truth. Preventive spending is cheap, but late-stage rescue, that is ruinous. So you might be wondering, why is this shift only happening right now? Well, 3 billion. That is the exact number of letters in a single human genome. The cruel paradox of modern healthcare is that medicine has accumulated more data than at any point in human history. Endless vital signs, gigabytes of imaging, genomic sequences, yet human clinicians are absolutely starved for insight at the bedside. A doctor with a 9-minute appointment simply cannot read 3 billion letters over their morning coffee. The knowledge is sitting right there in the library, but the librarian has zero time to read. Which brings us to Section 2, unburying the doctor through what's called the ambient scribe. The solution to this bandwidth crisis is wonderfully unglamorous, but economically it is vital. Enter the ambient clinical scribe. This is an AI that virtually sits in the consultation room, listens, transcribes, and drafts all the clinical notes and billing codes. It effectively unburies the doctor from a mountain of paperwork. By freeing them from the keyboard, it returns the single most impossible to manufacture resource in the entire building: human attention. It means that when you see your doctor, they are actually looking at you, not glaring at a monitor. It's a literal supply-side miracle wearing the disguise of a simple dictation app. Moving right along to Section 3, predicting the molecular whisper and the true power of early detection. So how does this actually work in the real world? It basically breaks down into 5 steps. It starts by ingesting oceans of raw data, standardizes it, and then goes to work extracting incredibly subtle features, say a faint asymmetry on a scan that a tired human eye might easily miss on its 90th read of the day. But step 5 is the real kicker. It integrates as a clinical co-pilot. It is not replacing human judgment. It acts as an amplifier. The machine reads everything and forgets absolutely nothing, while the human contextualizes the findings and takes responsibility. We are already seeing the massive real-world impact of this. Over in India, they've launched an AI-driven community screening for diabetic retinopathy. Historically, early detection has been heavily rationed by a lack of specialists, who tend to cluster in wealthy cities. But putting an AI tool on a cheap mobile device in a rural clinic lets a non-specialist catch blindness in minutes. You aren't just deploying software there. You are effectively manufacturing a top-tier specialist where absolutely none existed before.
Next up, Section 4, rewriting drug discovery through in silico innovation.
This is where AI absolutely attacks the legacy process. Just look at the timeline compression. The old world meant spending 10 to 20 years in a physical wet lab, where a failed hypothesis cost billions of dollars. AI shifts all that early discovery in silico, meaning computational simulation. Hypotheses can now die on a laptop on a Tuesday afternoon instead of a decade later in clinical trials. It creates a completely different, infinitely cheaper relationship with failure. And it's exactly why the treatments available to us in the next decade are going to completely outpace what was possible in the last 50 years. Because of this compression, AI essentially becomes a tailor with infinite patience. For ages, medicine has been sold off the rack to the average patient, which is really just a statistical fiction of someone who responds perfectly to median doses and gets zero side effects. AI officially ends that era. By reading a patient's exact, mutated 3 billion letter code, it can offer the actual patient bespoke, individualized treatments. We're talking targeted oncology stripes and personalized vaccines printed to the exact specifications of a single person's tumor. Now we have to look at the other side of the coin in Section 5, overdiagnosis and systemic risks, the shadow side. To get the full picture, we must talk about the inevitable tax on all this hypervigilance, and that is overdiagnosis. When an AI test finds everything, it also finds things that were never, ever going to hurt you, like an indolent tumor perfectly content to sit harmlessly for 40 years. If AI flags that, it can trigger a huge anxiety cascade and unnecessary physically damaging interventions. So the true measure of a great AI model isn't just what it can find, but its ability to distinguish a signal that truly matters from background noise that merely terrifies the patient. The Macro Butler newsletter also zooms way out to look neutrally at interconnected systemic risks regarding global food control and health. The text highlights how agricultural mandates, overarching dietary reforms promoted by groups like the World Economic Forum, and the ubiquitous use of herbicides present incredibly complex challenges. The argument presented is that converging regulations and chemical exposures are critical, overlapping variables in our overall health landscape that simply can't be ignored. Take widely used herbicides like glyphosate, for instance. The source material notes studies suggesting that even sublegal concentrations of these chemicals can trigger bacterial changes that actively reduce antibiotic susceptibility. The overarching point here is that while AI is rushing in to rescue our diagnostics, we are simultaneously navigating environmental and genetic exposures that remain heavily overlooked in mainstream healthcare conversations. Finally, let's bring it all together in Section 6, the macroeconomic rescue and the looming demographic time bomb. Stripping away all the tech, it leaves us with one truly fascinating economic question. Who is actually the single largest beneficiary of this entire proactive medical revolution? The answer is baked right into the financial architecture of the modern state. Moving from a conventional model of really expensive, late-stage emergency rescue over to an AI-based model of cheap, proactive maintenance is quite simply the single largest efficiency dividend available to the developed world right now. Moving a medical intervention forward in time doesn't just save a life, it deletes an astronomical, crushing cost from the entire system. And the primary beneficiary of that saved cost? The aging boomer cohort. We are facing a massive demographic time bomb. Falling worker-to-retiree ratios are exhausting our nurses, filling our beds, and threatening to completely crush sovereign debt with exploding healthcare liabilities. AI acts as the ultimate macroeconomic rescue. By keeping seniors healthy, monitored, and safely at home, it keeps them out of $1,000-a-night hospital beds. Escaping a crushed sovereign debt system protects your local economy just as much as it protects the hospitals. Ultimately, biology controls the budget. It really feels like AI is arriving just in the nick of time to catch the bill. Now, if you want to explore more deep-dive macro insights exactly like this one, investors can contact the Macro Butler directly at info@themacrobutler.com and definitely check out his website at themacrobutler.com. So, having walked through this massive shift from reactive medicine to proactive AI-driven prevention, what part of this technological leap surprises you the most?